866-314-4443. Got it.
And what's with the mariachi band?
You didn't say anything about Amazon.
On next week's episode of What Not to Do.
Come on, an elephant?
All right, 5 minutes after 11 o'clock. Nice looking day, 70 degrees. The weekend looks like it's going to be pretty nice. Partly cloudy skies tomorrow. No mention of any rain at all, and mostly sunny skies on Sunday. If you have ever had a prescription, and on the prescription it said, take all of the medication until it's all gone, right? And like 2/3 of the way through the medication, you have like no more symptoms. You're feeling pretty good. You say, you know what, I'll save the rest of this medicine and just ignore this, finish the medication, right, when it's use it all. Because you never know, I might get this whatever again. Well, the doctor puts that on there for a reason. I guess you don't need me to tell you that. I'm not trying to be the doctor, because I'm not. I'm a radio host. But we have a doctor on the phone to talk to us about this, and especially when it comes to atrial fibrillation, AFib, I guess is the shorter version of that. If you have it, you already know what it is. Dr. Mo Jalloh is on the phone. I'm probably saying his name wrong, I'm guessing. He's a pharmacist and assistant professor at Touro University, California, a contributor to Time Magazine, the Huffington Post, WebMD, U.S. News and World Report, Runner's World, and Men's Health, and others. February is American Heart Month. Let's talk about the importance of medication adherence. And good morning, doctor. How are you?
I'm good. How are you?
I'm okay. How did I do with your name? Let me start there.
And I want to let you know you actually pronounced it correctly.
Oh, good. Good. I'm glad. Where are you? Where are you calling from?
We're right now in Washington, D.C.
Oh, okay. All right. I started off with something I think we can all relate to. You get the medication that says finish them. You don't feel so bad 2/3 of the way through, and you stop, right? Mm-hmm.
Yeah, I've seen a lot of patients tell me they feel better after maybe 2 or 3 days of the prescription, and they say, I don't have to take it anymore. I can save it for later.
Yeah.
Unfortunately, some disease states that could pose a lot of troubles. Definitely if you have like AFib, that's definitely one you want to make sure you're taking it every day, because that's one medication you're not going to take only for a week. That's probably going to take it for a majority of your life.
The rest of your life, yeah. So what, define AFib for the rest of us. I think everybody who has it knows what it is. Everybody else probably thinks they know what it is, but help us out here. What is it?
Yeah, so think of AFib as like a regular heartbeat. The problem is that your heart isn't beating as well, and this can increase your risk for having like blood clots, having heart failure, and probably the worst of them all, having a stroke.
Okay.
Wow.
And what is the medicine, or does it differ from patient to patient?
It typically differs patient to patient, but the general gist of them is the medications are called blood thinners, in which they decrease the amount of clots in your body to help protect you from having a stroke.
Oh, okay. The one name that I think I know is Coumadin. My dad used to take Coumadin, yeah. But there's more than one, obviously, right?
Yeah, that's generic. That's the brand name for warfarin. That's like the common one.
Oh, okay.
Other ones include like rivaroxaban, Pixaban, dabigatran, or even adoxaban.
Oh, really? The Liberace band, that sounded like you said.
Yeah.
Oh, yeah. Yeah, that might be a good way to remember it.
All right, so the message for the radio tour is it that simple? Just make sure you keep taking it and don't stop taking it?
Yeah, that's really it. Make sure you keep taking it and don't take it. And if you are concerned about whether you want to stop taking it, then I would actually have that conversation with your physician as well as with your pharmacist, so we could come up with a plan to make sure you are not at an increased risk for having a stroke.
What about the person who does the exact opposite? They feel like if they take, 2 when they should have taken 1, they'll be better quicker, or simply better. What I'm guessing that's just as bad as stopping it, right?
Yeah, because if with any medication, if you take more than what you should, then you increase your risk for having a side effect. And that's why I recommend having maybe like some sit-down time with your pharmacist, and they can go over the medication and let you know how you should take it, so you don't have to take too much, but you don't forget to take it as well. And we can even provide tips about what are good ways to remember to take it and make it easy so you're not even thinking too much into it.
And there's also the cost involved if a person doesn't follow doctor's orders.
Yeah, there's definitely a cost. I would say, 1, you make it harder for the medication to work if you're not taking it. And 2, you're increasing your risk for being hospitalized. And there was actually a couple studies showing that over $100 billion, and billion with the B, was spent in patients who were in the hospital because they weren't taking their medications. So I think it's something is an easy solution or easy intervention of taking your medication daily to prevent such costs.
Okay, so you said you had a 5-step plan to help remember. I'm going to start taking notes. I don't have any right now, but I had some last year, right?
Any notes?
Not this. No, I mean I had no medications except for last year. I had some for my leg. Remember?
Yeah.
Okay. But knock on wood, so far nothing with the heart. Okay, now I'm going to die. Now that I said that. All right. So what are the five things?
I'm sorry?
I was just asking if you could tell us what the 5 steps are, the 5 ways to remember.
I would say not there's like a 5-step rule, but I would say common things you can do is try to take your medication at a time you're doing things that you do every day. For example, right before you brush your teeth, that would be a good time to take certain medications because that's brushing your teeth. I hope everyone's doing every single day. So that might be a good way for you to remember to do that.
Yeah,
or eat lunch or dinner or things that you do every day, you can probably just insert it there. Number 2, make sure you can work with your pharmacist and they can make it easier by finding single-day medications. For example, there are some medications that you take multiple times a day. We can actually convert them into ones that you probably take only once a day instead of taking those ones every couple hours.
Oh, really?
Yeah, there's a couple
nice.
medications you can kind of convert that way where they have like a long-acting form that you can take once a day. Another thing you can do is take combination pills. There's a lot of medications where they actually come in a single pill formulation, and we can take a look at your medications and then come up with a plan to say, oh, these are available in a single pill. Instead of you having to take 2 pills of this medication, we can just give you 1 of that. So that can make it a lot easier for you to remember to take the medication as well.
Okay. Is that something you ask your pharmacist about, or does your doctor have to prescribe the combination thing?
You would work with your pharmacist as well as your physician because, of course, your physician's prescribing it. But pharmacists are more likely to know that information because we're seeing the medications dispensed all the time. And I know physicians, they have so much on their plate, it's hard for them, I can imagine, to remember which medications come in combination and which ones are separate. But for us, that's one of the key things we do in our job.
Does it take a little while to regulate the medication for the individual person, especially if they have diabetes or high blood pressure or thyroid?
It depends on the person. I wouldn't say that it really depends upon the patient as well as what their severity of high blood pressure or high blood glucose or diabetes is, as well as what their motivation is. It really depends regarding what their history is. But in most cases, if they're really active, I've seen patients almost turn 180 after only a month of working with their pharmacist.
Oh my
really?
gosh.
All right. So can you address this particular question? Let's say somebody's at the pharmacy. They pick up their prescription. They're with a friend. The friend says, there's an herbal treatment for that. And the friend says, oh, show it to me. So then they go down that aisle where all their supplements are. Mm-hmm. They find ginkgo biloba or one of those things, and then they just buy it. I mean, is there a risk of kind of doubling up on something that's considered herbal or holistic, that kind of stuff?
Yeah, I think one thing people should keep in mind is just because it's a herbal thing or it has a herbal on its name, that doesn't mean it's 100% not safe or 100% safe. There's actually side effects that can occur with taking these herbal products, and some of these can actually interact with people's medications. A key one is St. John's wort, which it actually decreases the levels of a lot of medications, and that's why it's really important. If you want to start a herbal product, that's fine, but why don't you bring that conversation to your pharmacist? Because then they can run through and look at your medications to see, is there a significant interaction? Is there something we need to be concerned about, and kind of counsel you? And in some cases, there are some herbal products that actually do work, and we can even let you know if one herbal product's bad. We can even give you substitutes that this herbal product might actually be good for you instead. So we're not saying that you shouldn't take herbal products, but just speak to us, and we can help guide you in that therapy.
Let me make sure the listeners can get the information they need. Do you have any websites you can recommend?
Yeah, I highly recommend. If people want to know more about how they can keep their heart healthy, definitely go to the American Heart Association website. I think they do a good job of making very basic information and making it easy for people to understand information about their heart as well as heart diseases. And I recommend going to the American Pharmacists Association website or pharmacist.com. They have some cool articles about new medications as well as medication news, as well as tips and tricks on what people can do to make it easy for them to take their medication.
Good information, Doctor, and good advice. Thank you so much for taking time out of your day to be with us today. Dr. Mo Jalloh, thank you so much.
No problem. Thank you for having me.
All right, we will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Friday, a mix of clouds and sunshine, high 78 to 82. Partly cloudy Friday night, low 56 inland, 62 on the coast. There can be some